President Uhuru Kenyatta has ordered the Ministry of Health to make public all the contracts undertaken by the scandal-riddled Kenya Medical Supplies Agency, that's KEMSA. The President giving the Health Ministry 30 days to give public details of all the procurements, including winners of the tenders, to allow investigative agencies to scrutinize the trail of the missing COVID-19 billions. This, as Health Cabinet Secretary Mutahi Kagwe maintained his innocence, saying linking him to KEMSA was political.
The President invoked an executive order he issued in 2018 in a bid to clean up the mess at KEMSA. Uhuru directing the Health Ministry to upload all contracts awarded by KEMSA for scrutiny in the wake of allegations of misappropriation of billions of shillings meant to combat COVID-19 pandemic.
The Ministry of Health, within the next 30 days, must come up with a transparent, open method and mechanism through which all tenders and procurement done by KEMSA are available online so that we can see who has been awarded a tender, we can see what is the value of that tender.
The President essentially going back to his Executive Order number 2 of 2018 on procurement of public goods, works and services by public entities that appears to have been largely ignored by public officers. The executive order that came into force on the 1st of July of 2018 compels public entities to maintain and continuously update and publicize complete information of all tenders awarded. This including the full details of the supplier, contractor or consultants, specification of goods or services being procured, technical and financial capacity of the suppliers, the award date and contract period, the market price of the goods being procured, and the price guidelines as published by the Public Procurement Regulatory Authority. Also to be published online is the membership of the Evaluation Committee and the Inspection and Acceptance Committee of the procuring entity.
I think this level of transparency and through the use of technology will go a very long way towards ensuring that we have the confidence of our people, that those who are placed in institutions are able to manage the resources of the Kenyan taxpayer plus our development partners in an open and transparent manner.
If we do not do this at the national level, then I do not think we are very serious about dealing with the threat of the more important C virus, and that is corruption.
This is the President's second of such orders aimed at unearthing the mess at the Medical Supplies Agency. Last week, President Kenyatta ordered investigations into the KEMSA scandal be completed within 21 days. This as Health Cabinet Secretary Mutahi Kagwe claimed the KEMSA scandal has been politicized and weaponized to drag his name through the mud. Suspended KEMSA CEO John Manjari implicated Kagwe and Health Principal Secretary Susan Mochache for dictating to the agency which contracts and contractors to be used.
There were requests from the PS, Susan Mochache.
Yes.
There were requests from the Cabinet Secretary, Honorable Mutahi Kagwe.
Yes.
The CS for Health must and should and must continue to engage the executives in my parastatus.
Parliament has demanded for a thorough audit of KEMSA's expenditure in the purchase of COVID-19 emergency supplies, with the Principal Secretary and the suspended management team expected to appear before the Health Committee later this week. Sam Ogena, Citizen TV, Nairobi.